We have with us today Harvey, who is 72 years old now. He's been a patient of mine for 9 years and has been on testosterone replacement since September of 07, so that's 15 months. So what were the circumstances that led to me starting you on testosterone replacement?
Lack of sex.
I had asked you how often you were having sex.
Yeah.
And you were having sex how often?
Once or twice a month, maybe.
Or maybe less?
Maybe less.
And you had no other problems from the testosterone deficiency. As far as you were concerned, your strength and energy were okay, mentally you were okay?
Yeah, everything else was fine.
Just no desire for sex?
Yeah.
So we did a free testosterone level on him and it came back quite low. By my criteria, if he had 3 times as much, he still wouldn't have had enough. And by the laboratory's criteria, if he had 8 times as much, it wouldn't have been too much. So he was significantly deficient. We started him on testosterone, and so that was in September. And the first time that you felt anything was about 4 months later in January?
January, yeah.
And you started to think about sex more? What happened?
Yeah, well, it was good.
And then I think by March it had its full effect.
Yeah, I felt like I was 18 again.
Oh, that's good. And how often were you having sex then?
3 times a week.
And now?
3 times a week.
Okay, so we've had 9 months have passed. And
Yeah.
is the testosterone still as effective as it was at the beginning?
Yes.
Okay. And of course, you haven't noticed any increase in your energy or your strength?
No, that's all stayed the same.
That was always been good. Okay. But some other things did happen with you because you're a diabetic and you have a high cholesterol.
Yeah.
What happened with your cholesterol from the testosterone?
Cholesterol dropped. I'm taking half of my usual dosage of Vitamin, where I cut in half.
So instead of a full pill, now
I'm
you're taking a
taking
half a pill because your cholesterol went so low.
Yeah.
And your sugar got better.
Sugar dropped also.
Okay. For those of you familiar with the numbers, when we started, Harvey's glycohemoglobin was 6.5, and with no diet change and no diabetic medication, in January of 08 it was 6.3, and this past October it was 6.2. So his glycohemoglobin is slowly coming down only because of the presence of the testosterone. Have there been any side effects?
No.
Anything negative about taking it?
No.
You're happy with it?
Yeah, it's good.
Okay, thank you very much.